World Financial Group offers entrepreneurs from all backgrounds the opportunity to start their own business on a level playing field. Dr. Yana Woodhouse, receiving the WCM Wall Street Pioneer Award by the United Black Wall Street of America, Inc., is one of those entrepreneurs.
I see WFG and TFA as a place where African Americans with an entrepreneurial mindset can flourish. And the bonus, we help families and serve the communities across the country.
To learn more about us, go to worldfinancialgroup.com.
We are the sons and daughters of the soul. We are resilient and forever forward-thinking. We ask for nothing else than the opportunity to live and to create the lives that we were meant to live. We want nothing but an equal chance at options and possibilities. The same possibilities and options to live out our potential as our fellow man. We want to be heard, understood, and expressive in our reality. We are the future. We are the creative. We are here.
This is Kia Rogers, and you're listening to Urbanology with my dad, Tony Rogers, on WHCR 90.3 FM New York.
Good afternoon. Tony Rogers here, your host for Urbanology, the Art of War. I hope all is well. It's been a busy week. I mean, there's a lot of stuff going on. One of the things that I have been really focused on is the soft opening of the MedPod Wellness Clinic that's going to take place on December 18th and 19th in Harlem. This is the first clinic of its type in the country, and it will make a tremendous difference to the healthcare system. There's been a lot of controversy about the healthcare system and what it does do and what it does not do. And but we still have to look at how we are able to get not only individuals from Harlem, but individuals throughout the world, the proper type of health care, which is extremely important. And the MedPod technology is going to be a leader in mobile diagnostic. And I think that know that the office in Harlem will be a model that will be duplicated throughout the country and abroad. So I am happy to introduce you again. This is part 2 of our interview to Jack Tawil, who is the CEO and founder of this MedPod technology that's coming to Harlem. See you again, Jack.
Thanks for having me back. How are you?
Well, it was so much information. We had to do a second interview, especially since we're opening the soft opening December 18th and December the 19th. But For those who are looking at this for the first time, Jack, please briefly give, because it would take a whole show to talk about all the stuff you've done, but uh, talk about the things you did prior to getting into the healthcare system, how you got into the healthcare system, leading us up to MedPod.
Yeah, the brief background is that I was in large retail programs prior to coming into healthcare. Did things starting with Swatch Express in 1990, which was the Swatch Watch kiosk program. Worked with Harrods out of London. Worked with the Queen on Royal Ascot in England, and another number of other brands that are known, Land Rover, Fastenab, and so on. And I crossed over at Walmart. It was about 2002, 2003. We came up with the concept of opening up healthcare access points within Walmart stores. And that became the basis for really what we're doing today. And so, at that time, we were opening up in Florida, Alabama, Mississippi, Louisiana, and essentially created the first 23 facilities across those 4 states, delivering healthcare directly to patients in a new model using nurse practitioners, which was not very well known at the time. What is a nurse practitioner or an extender? And so we essentially helped create that model. During that same time frame, one of my speeches became the basis for the not-for-profit dossier, which essentially was used to model Health Information Exchange Act written until 2009 by President Obama. And then also one of the founders of the category of convenient care, delivering healthcare conveniently to the patients, but it became a category of care as well.
Well, again, the Walmart, they were all in rural areas, basically not rural, but southern locations. What was the incentive of creating the first clinic in Harlem?
Well, it was really, there was some people involved, right? And so some of the people that we're working with, Bobby Zara Hunter, Ed Miller, and they were already familiar with the technology. They already saw what MedPod was capable of in other parts of the country and other parts of the world. And they said, we need this in Harlem. I mean, everyone thinks that it's urban, but it's still a desert from many perspectives, not the proper level of care. Of course, you can end up at the hospital and get great care in the hospital, but at what cost? And so we were taking an approach of creating a baseline of every patient, get to know the patient, and then use the technology to actually capture what we call high fidelity data, clinical data on that patient, so that when they come back or they represent, we actually know them and could actually make a diagnosis based on that, knowing and understanding them. So they saw that as something very different. And they encouraged us to say, why don't you, if you're going to start your first direct-to-patient care delivery, start it in Harlem. Let's actually do that. We partnered up with the Coletown Group, which has a great property up on 144th and 145th Street and Malcolm X Boulevard. And we started to build out that clinic just under a year ago. And so we're now ready to go.
Well, again, it's just like New York. If you can't make it in New York, you can't make it anywhere. So Harlem is in New York. Matter of fact, Harlem is in Manhattan, which most people say that is New York. I mean, I know you're a Brooklyn guy and Staten Island and Bronx and the Queens, but, when we talk about New York, we tend to focus on that. And I am happy because that brought me into the fray, which has allowed for me to digest so much of this information. One of the things that I get a lot of as far as questions is who will qualify to come in if someone walks off the street and they want to take advantage of the MedPod technology at the clinic. What's the target market and what do you have to have in order to take advantage of it?
So I would say everybody is the target market, right? So we're really a family practice, right? So we're providing care for older patients, for seniors, patients of all ages, including children. Not pediatric just yet, but ultimately we'll get there as well. And then ultimately we'll even get into dental and some other areas. But for now, it's really whoever number one wants to have different care. We're able to do this baseline, understand them, give them what we call concierge level care for everybody. And so the care that you would normally receive, right, if you're paying a lot of money, we want to deliver that, but to patients that don't necessarily have the ability to pay like some of these VIPs. And so we're delivering care and accepting Medicare, Medicaid, a whole bunch of the Medicaid managed programs, as well as Medicare managed programs, mm-hmm. as well as private insurance. And so very broad. It's not every insurance, but many of them. Mm-hmm. And there's a list that's been published of all the major insurances that we're taking.
Yeah, I know. I sent a note out to AARP, one of their representatives, and asked them to come to the openings because obviously they deal with a lot of seniors. It's also been kind of difficult to actually explain exactly what MedPod is. Could you give an example of what if someone is in? Well, two things. One is one thing coming into the clinic and you get your baseline and your vitals taken, but you have backpacks and you have carry-alls. To go to someone's house or in a nursing home or someone who just can't get out of bed, what are the vitals that can be taken? And one, and two, can they use their own doctor, or is there a lot of doctors who could be called upon to view those vitals at the time that you're taking the examination?
Yeah. I mean, so we call MedPod and that clinic, specifically the MediLink clinic in Harlem, it's a technology-enabled care delivery. And so we're using technology to be able to bridge the gap, to bring doctors throughout the state of New York, licensed throughout the state, to deliver care at that location. And on the last show, I mentioned that we have a doctor that's taking care of some people in the current administration, in Washington, that come into our clinic every Thursday, and they're available to see patients that will walk in right off the street. So the level that you're getting is literally one of the most important people within the administration. The same doctor that's taking care of them is now available to take care of anyone who walks through the door. But in addition to walking through the door, we actually could come to you as well. And when I say technology enabled, what that means is that we have a unit, it's called the mobile doc unit. We also have one called a MedPack. It's a backpack version of the mobile doc. But the mobile doc is a small unit in the size of a carry-on piece of luggage that a care facilitator or nurse or some lower level technician will take over to the patient, wherever that patient is, think their home or another location, and bring their doctor or one of our doctors up on the screen and do a live examination where all the vitals are flowing across, all the scopes are flowing across, and so the otoscope, which is for the ears, or the general exam camera, so to look in the mouth or generally how they're doing. Dermatology, so look at the skin, go in and check their heart and their lungs, listen and record that information. Get into EKG, into spirometry, and so on, all right in the comfort of their own home. And so we're enabling a group that we call the sick and shut-in to receive care at home in that way. Or again, they're welcome to come into the MediLink clinic on Malcolm X and 145th Street.
Well, again, it's changing the way health care is given. Now, I know that there had also been some changes in legislative language as relates to telemedicine and mobile health care. Well, actually, you probably are the first that really did the mobile health care, but from my conversations with you and other interviews, I understand that the mobile healthcare component that we have with MedPod now has been part of that new legislation that can be taken.
Yeah, I think there's a lot of confusion about telehealth and after the pandemic, right? So technically, we're coming out officially of the pandemic and all the rules that were associated with them, specifically around Medicare. So for Medicare recipients, and we're going back to the 2019 rules. And so the question ends up being, well, what were those rules, and what does that mean to care delivery? I think on the telemedicine aspect, having video conference with your doctor remotely, I think that's actually being regulated to a large degree. It won't be as easy to do that. The doctors are not going to get reimbursed for a lot of that care unless it's specific conditions, maybe around mental health and things like that. But as far as your general checkup being done remotely via telemedicine, that's not going to be so easily reimbursed around Medicare. Private insurance and some of the other programs may actually continue, and they were actually, many of them were following what's called the parity laws. At the time, I lost track today, but at the time it was about 44 states that required a private insurance to reimburse on par with a physical visit for a provider that's using technology. But Medicare actually had other regulations around location. Are you within a metropolitan service area? Is a physician shortage area? What's considered what they call an originating site where the patient is, and as well as a distant site where the provider is. We're using technology to see that patient. Our model seems to have come through into 2025, where we are involved in what's called direct oversight. So you're now allowed to utilize technology for direct oversight of a lower level technician, right, auxiliary to the doctor. So we have technicians, what we call them care facilitators, and they're working under the doctor in direct oversight of the doctor, where the doctor's coming into the session live at some point in that session. And so we are of the belief that 2025 certainly, as well as going forward, our model is approved and able to both diagnose, treat patients in any environment, including their home.
And as it relates to New York State, could you just briefly talk about the program that you conducted in New York State?
Sure. I mean, we did a program, again, pre-COVID, where we actually saw that New York State had a problem in their intellectually developmentally disabled patient population. At the time, again, going back to 2017, 2018, there was about 126,000 patients that were considered IDD, or again, intellectually developmentally disabled. What we noticed was there was a major cost associated with the delivery of care to that patient population for nights and weekends. And so what happened as we started to dig in to understand what was going on is that if you're in that category, very, very often you live in a group home. Maybe there's 6 or 8 patients that live in a group home. They have some medical staff that cycles through, maybe a nurse practitioner that comes once a week to check up on the patients. They go out, they're outpatient. They may go see the doctor in an outpatient setting. If there's an issue during the night and weekend, they have no choice but to call 911, meaning the attendant that's within the home, to call 911 and to transport them to the emergency room. And so what was happening was because they couldn't be seen by their doctor that knew them, they couldn't go to an urgent care. There in many cases they're nonverbal and much more complex situation. So what was happening was they were calling 911. They were actually getting transported to the emergency room. At the time, was a cost of about $2,000 per visit, and about 50% of them were getting admitted. And at that time was $14,500 as the average admission. Right. So as soon as you picked up that phone, potentially you're costing the state $16,000 or $16,000+. So when we looked at that, we said, well, this is not necessary. How many of these incidents are non-emergency, shouldn't actually take place in the emergency room? And we set up a triage line. We, of course, advised the attendants within the group homes that we work with that if there was a situation, if it really was a situation, call 911. But if it looked like it was non-emergency, call this other number. We'll do a further triage. And then if it's appropriate, we'll dispatch a nurse. In that case, it was an RN with one of our mobile doc units. It will go physically into the group home and had to be there in less time than it would take to see a patient in the emergency room for a non-emergency condition, which was a couple hours. And so we hit that over and over without an issue. And we were able to reduce hospitalizations by 86%.
Say that again. How much?
We reduced hospitalizations by 86%.
80%.
86.
86.
86. And on top of that, we reduced anxiety for that population by 93%. And when we looked at it, the state on the testing, they did a test of 8 units, 16 nurses, triage line. They ran it for 6.5 months. They spent $250,000 on actually building out that little program, but they saved $2.4 million directly in 6.5 months, right? So 10-time return on investment in 6.5 months, 20-time annual return on investment. So that resulted in a white paper, a study, and then actually the drafting of the law and the passing of a law, making it mandatory in New York State to be able to both receive and pay for care, MedPod-like care. Obviously, you can't say MedPod, but it was based on MedPod, to be able to have that patient population have access to such care. And then, of course, the COVID came, after that, and then it opened up for the world, so to speak. And now it's kind of closing up again. And so, MedPod still sits at that spot where we're in a very good position from the way of parity laws and others where we comply.
So MedPod led the way. Are there other duplicates or other people in the field at this point that can do what MedPod can do?
Nothing similar. I mean, there's some things that are at the very low level, right, where you could do an exam at home and a very inexpensive home-based type of device, or something that was inexpensive that made to be a more expensive version of the home-based, right. But it's not on the level of professional care. We really took the equipment that's normally have been bolted on the walls of an exam room, right. and essentially enabled that to get mobilized and then pushed to anywhere. Again, for inbound patient applications where the patients are physically coming into a place like our clinic in Harlem at 145th Street, the Meadowlane Clinic, or we're pushing into their home.
Now, I know that there's been some international work, and you were able to do this. I don't know whether you could do it now, but could you pull up the short video that I like, because I sent it to Africa, as you know. I have a tremendous desire to make sure that we introduce this technology to Ghana and other places, I guess, Africa and the Caribbean. Is it possible for you to pull that up?
Absolutely.
And this would also give people kind of a way of looking at, if this works in an African country, obviously it could work in Harlem and other locations that are a little bit more sophisticated. However, there are some rural areas that probably are no more sophisticated than some of the places that this has been tried in African and Caribbean countries.
Yeah, could you see my screen?
I can see it.
Perfect. So this is one of our customers, essentially using MedPod in an African environment.
Some of us are lucky. If we're in need of healthcare services, we have several options to choose from. We can go to our local clinic, and a physician will ask us questions, do a physical assessment, and diagnose our ailments. But for much of the world, this is not the case. As you venture further away from larger cities, healthcare becomes more challenging. Seeing a doctor can be virtually impossible, and the nearest doctor is a day or more away. Even if you're blessed with good insurance, you may be forced to travel to a major city to have a physician visit. But welcome to the future. Through a partnership with the DMC Hospital and ArcPoint Labs, we are reimagining rural healthcare. This device will allow a doctor to attend to a patient from anywhere. We are set on a mission to provide equal care to everyone in the world, regardless of who you are and where you live. Let's reimagine the doctor's office visit. Let's reimagine rural healthcare. Let's reimagine diagnostics. Welcome to the future.
And again, that gives an example of where we're going and where we are and where we're going as far as the future. And it's my understanding, based on your conversation, that there is now also an AI ingredient that is going to be merged into MedPod. Could you talk just a little bit about that?
Yeah, we've been doing AI before it was really popular. And so, we started even back in 2012, 2013, collecting what they call the ground truth to be able to inform the AI systems to be able to help diagnose and ultimately treat patients. 2016, we ran a program with the National Science Foundation where we started to collect a number of images. And so one example was where we would use our otoscope, digital video otoscope, to capture both images and video and feed it into a system, learn, categorize the information, and to the point where the system was starting to recognize and call otitis media, for example, or swimmer's ear, and then give the likelihood of it being one of those two. And so we've done that. MedPod technology in general really is the ground truth. It creates the data for the ground truth that informs the AI systems. And anyone who's heard about AI hears about the hallucinations of AI, right? That AI is making stuff up and it's not necessarily in reality. And it's going to make stuff up if it doesn't actually have the right data and the right inputs. And so what MedPod is doing is actually inputting the proper information. That's why we say the high fidelity data to inform those AI systems, the machine learning, the natural language processing systems, so that you actually have very effective healthcare AI technology coming out.
And this type of technology will be at 144th Street and Malcolm X Boulevard, opening up February the 6th with a soft opening on the December the 18th and December the 19th.
Yes, we're showcasing MedPod technology in that location, letting everyone know that it's possible. The other thing that we're also doing is that we were always told, and we have hundreds of these units that are out in the market today that are operated by others. It's operated by our customers. They could be hospital systems or doctors, independent doctors. It could be group practices, as well as others from different countries, right? So we have literally units around the world. But we were always told in America, you can't actually deliver care to a Medicaid population and make any money at it. And I disagree. And my position is that if you're smart about the way that you're using technology and creating efficiencies, you could have a very good business, a profitable business, by saying 100% Medicaid patients. And that, if you look at the way that healthcare has been delivered, anyone who's delivering Medicaid to a Medicaid patient population, they always talk about it being to a percentage of the population. Well, I could afford to see 20% of my patient population being Medicaid because they see that as a loss, right? They're doing good by saying, I'm making money on the other 80%, and so I'll take a loss based on the reimbursement I get from Medicaid. And we took a different position, and we said, no, even if it was 100%, if you actually change the equation of how much it costs to deliver care by doing it the way that we're doing, technology-enabled care delivery, you're able to actually expand out into all populations regardless of the cost and the reimbursement.
Something was said on, we've been doing a number of Zoom conversations, but something was said that I thought was important also, is that this technology will allow for a doctor to not be confined into his office. This doctor could be any place and and work. That's another important initiative.
Yeah, I like to say that we're tearing down the walls of healthcare, both literal and figurative, right? And really, what I mean by that is that one, we freed the exam equipment right from those walls that they were bolted to, and mobilized them, put them into a mobile dock or a med pack or a cart, right, depending on the environment. And then we also freed that provider that they could literally jump from location to location using the technology to be able to diagnose and treat patients. Our doctors are saying they could actually do it better than they can in a physical event, a physical exam face to face. One of our doctors recently said, I think you were witness to this, that he could hear better and see better than with his own stethoscope locally and his own otoscope. And one of his comments, which was interesting, was post-COVID, he doesn't go in with his otoscope as close to the patient as he used to, because they're uncomfortable, he's uncomfortable. And so he goes in really quickly, tries to get a quick read, tries to make that diagnosis. But with our technology, he could actually hold the otoscope at a distance remotely, or the care facilitator could hold it. He could capture, or she could capture the information, see it up on the screen, highlight it, even show the patient where they see, let's say, the infection or whatever it may be, get a better diagnosis, but then also commit that to the record. So you have a better record keeping as well. So changes the way that care is delivered. Even if you never turned on the video, so to speak, where the doctor is remote, the clinical capture on the local side is better than anything that's ever been done before.
One of the questions that was asked, I know we've been talking to people in Alabama and Baltimore, but one of the questions that comes up is, how can the local doctors where, let's say, Alabama or Harlem, how can the local doctors be put on the system so that individuals can have a choice of a specialist in the area, no matter where that specialist is, but also can still see their local doctor when necessary?
Yeah, I mean, so we always build local networks, right? So it's not necessarily MedPod delivering care with our doctors that are setting up in the cloud somewhere. It's all about working with those local doctors, as long as they're willing to work with us, right? So if they're willing to come on board and say, look, I'm willing to come on, literally from our side, we could issue them a username and password, have a contract between us so that they could deliver care on the system, on the platform. And they could deliver care. They could very easily get in. We had an example, and this happened a couple of years ago when our friend Lou Gossett Jr., may rest in peace, when he actually invited us to come over. He was intrigued by MedPod, and I shared that story last time. And he said, "No, I don't want one of your doctors to diagnose and treat me. I want my doctor to." And I said, well, "Okay, get your doctor on the phone. We'll issue him a username and password." And we did, and he literally came up on the screen with no training and figured it out. And we gave him a little bit of a hint: look here, look left, look right, and so on. But he was able to figure it out on the fly and remotely diagnose and treat. And all he did was he used his own equipment. He used his own computer. He used his own headphone, still be able to listen to heart and lung sounds, remotely control the scopes, capture what he wanted to capture. And again, literally within minutes, he was diagnosing and treating.
And this is something that obviously can also save time, because a lot of people don't really have doctors. If they get sick, they go to the emergency room,
right?
And they don't really have a healthcare provider.
Yeah, I mean, this has the opportunity to cut out an enormous amount of cost for the overall system, right? And that's one of the issues we always see. Healthcare costs keeps on going up as part of the as a percentage of the GDP. You never see it going down, and you hear these cost containment strategies. This is not a cost containment strategy. This is actually a cost reduction strategy. It's the ability to say you don't need to go to the emergency room. You don't need to go to high levels of cost associated with the care delivery. I wrote a paper a long time ago saying that, of course, a plastic surgeon could take care of your cut, but at what cost, right? And so you have to associate the right level of care with need, and actually we're able to do that based on the MedPod technology. You could bring the appropriate doctors in remotely. You could use the appropriate low-level care providers, which we call care facilitators. You could actually create a whole new category of care and care delivery, because we don't have enough of our traditional care delivery workers. And with that, very quickly solve the healthcare shortage.
So I guess where there's a yin, there's always a yang. I'm sure that some people may say, wow, they may put me out of work. But you also are beginning to hire people to begin to do this. So there's another career, employment, and volunteer stream in our clinic in Harlem. Can you talk a little bit about that? And how
Sure.
get into
Yeah. First, to address the put people out of work statement, the doctors, which would be the logical ones that would say that, actually there's a shortage, right? So if we're able to utilize those doctors that may be in one geographic location with the proper licensure and have them serve a shortage area, shouldn't we do that, right? And so the answer is really there won't be any lack of work for the doctors. There's plenty of work for the doctors. They're just going to be more efficient, and frankly, they're going to do the things that they want to do. I asked the doctor, why'd you get into medicine? And he said it was all about the cognitive. It's all about looking and listening and trying to diagnose and figure out what's wrong with that patient. And your system allows me to do that without all the paperwork, without all the stuff that I don't want to be doing. So that solves that one issue, right? The shortage. And I don't think we'll have too many doctors saying that we're going to get rid of them. But from the other standpoint, we are creating a new healthcare worker. And in the Harlem Clinic is a perfect example where we're hiring individuals. It could be literally individuals that are low-level healthcare within the provider area today. And when I say provider, I don't mean doctor or nurse practitioner, but more of an MA, an EMT, a paramedic level, or even a phlebotomist, so they could draw blood and do other things. And if we'll train them to be a care facilitator on the MedPod system, to be the hands of the remote provider, to teach them how to remotely, be those hands where look in the ear. How do you properly look in the ear? How do you properly look down the throat? How do you capture moles on the skin and things like that, and present them up for the provider on the remote side? So that's part of our training that we're doing at the clinic. Of course, we're looking for care facilitators for that clinic, as well as other programs that are taking place throughout the country. It's not just Harlem, but there's a program in South Carolina on a statewide basis that we're working on as well as some other states. So there's plenty of opportunity to create a new care worker. Again, we're calling it a care facilitator, and happy to train them or work with existing staff to train them.
And if anyone viewing this would be interested, they can also contact Urbanology Systems at gmail.com. That's my email. And I can send them the qualifications that may be necessary. Or on, I believe we said December the 19th will be the day for those individuals who would like to come in. And you were right, because we're talking to, this is probably, this time next year will be in a number of different states throughout and places outside of the country. So the employment opportunities for those persons who come up to speed and learn how to do this in Harlem allows for them to travel and to go to other places.
Yeah, there's an army of healthcare workers that are needed, and we do believe that this is one of the pathways. And I should say that it could be even retired healthcare workers, right? So a retired nurse or some other level.
It's a new thing, yeah. You don't get bored.
It could also be younger people that are interested in
medical students.
Healthcare. So students would be perfect for this as well. Anyone who's good at technology and anyone who's intuitive, right, could understand. I give the example, if the doctor says, to the patient on the other side, let's take a look in your ears. We don't have to tell you to pick up the otoscope. You know to pick up the otoscope.
Mm-hmm. Well, and again, people can be trained. I had a very brief training. It was almost like the Navy. They teach you how to swim by throw you in the water. So, but it's it's something that is not rocket science. Just as long as the doctor on the other end knows what he's doing, it's something that people can be trained on. So it's a tremendous opportunity. I was going to ask you this question, and I keep forgetting it, but since you have the backpack for MedPad, has there been any conversations with the military?
There have been military conversations. It was actually developed with a military application in mind. It's not yet sold, right? So it's still a product that we're using first in Harlem, testing it, perfecting it, and then we will sell it out. The mobile doc unit's been out there, in hundreds of locations, right? So that's been widely utilized. But we created the backpack version, primarily thinking about all the walk-ups, right, in Harlem and around Harlem, where maybe there's no elevator. You don't want to lug a piece of luggage up the steps, but a 13-pound backpack works well.
Yeah, I know that there's a conversation with some engineers that deal with some of the military contractors that you'll be talking to. Which, when I heard that, I said, "Wow, the backpack should be something in that conversation also."
Yeah, it was built with military specs in mind.
Yeah, because I can see how that could be extremely helpful as relates to just people who are in these areas and need help, just like the people in the area that they're protecting. But the military might need. They're not close to hospitals either. Instead of having
they could be for forward operating bases and other, but also there's a big opportunity for that for EMTs, right? So to be out on the ambulance and provide care in the patient's home, right off that ambulance, instead of transporting them, actually providing care.
Keeping that in mind, what happens when there's no internet or there's no broadband? How can that work? Whether that could be in rural areas, or that could be on 135th Street.
Right. And so, interestingly enough, we actually operate on very low bandwidth. So when there's very small amount of bandwidth, and there was real examples where we did quite a bit of testing out in the Hamptons. And you would think, well, the Hamptons must have phenomenal internet. Some of those places, literally, you couldn't get a phone call through.
That's why they go there.
Yeah, but MedPod was able to get through on 0.20 megabit per second, so exceptionally low. And we just did a program in Malaysia with a partner company called Amdocs. They're known to build out infrastructure, around, let's say, 5G infrastructure. And one of the things they did was they brought a mobile cell tower with them. And so they literally brought it looks like a MedPack or MedPod unit, like a mobile dock, about double the size. It has antennas coming out of it, and essentially got on site. It was plugged in or battery generator. They used Starlink as the backhaul network. And MedPod was working on that network that was set up literally in rural villages throughout Malaysia over the course of about 10 days. And so went throughout Malaysia, showing how remote and how you could actually get it up and running.
Well, again, I think we've covered a lot, but there's just so much more to cover. Those who are listening, again, the dates, and we'll give the exact address, but the dates for the soft opening for those who are in the healthcare industry, those who are in the insurance industry, senior citizen centers, homes, hospitals, and the like. There's going to be an awareness and information day on Wednesday, December the 18th. Those who want to come in to get a checkup or to understand how this can work for them with their insurance and sign up for baseline examinations and the like, that will be on the 19th. On the 19th is from, I believe we said from 10 to 4. Correct. And on that Wednesday is from 2 to 4. So And of course, the clinic will officially open on February the 6th. We'll probably do something else to actually promote the official opening. But again, I'm talking to a person who every time I talk to him, I learn a little bit more. So now that I have a lot of Swatch watches. So now when I go to 34th Street, I'll say, hey, I know somebody who came up with this idea, which I like the watches. They're pretty cool.
Yeah.
And I guess it's safe to say, Jack, that you're the one that really introduced telemedicine to America in some form.
Yeah, we actually ripped up parking lots and sidewalks in Walmart in 2005 and 6 and 7, laid fiber in the grounds and stood up really the first direct-to-patient telemedicine network in the country. We believe it was the first in the world, frankly, direct-to-patient. They up until that point, they were really doing hospital to hospital or NASA programs, things like that, but not anything that was direct to patient between a provider and a patient. And we had to build our own networks of doctors, across those states and, get all the proper licensure in place. And so we were pretty early on in what you would call, telemedicine. But this is different. This is telediagnostics. It's diagnostic telemedicine. That
diagnostics is the next step for telemedicine, I suppose.
Correct.
The first office is going to be in Harlem on Malcolm X Boulevard. So that is good information. We have the website. If anyone has any other questions, you can go to urbanologysystems@gmail.com or give me a call at 917-821-7099. I'm proud to be one of the spokespersons for the clinic and the person who's really making sure that not only for Harlem, but through all of the different locations, that people understand that this is something that's new. It's something that's extremely valuable as it relates to, again, everybody wins. I like those types of situations where everybody can benefit in the situation. The doctors can be free, the patients can be free, those who establish workshops and clinics like MedPod can look at a business opportunity, and there are volunteers to be able to help, senior citizen centers and the like. So it's everyone can win, which is always the best deal. when everyone can see how they can benefit one, whether it's personally, career-wise, or investment-wise. So again, Jack, I'm glad that I've been able to get into your orbit. I have to always thank Bobby Zorro Hunter, who now he says, well, now that you guys are together, his new name is Poolside Bobby. So I don't have to do anything else.
He's been running around the country talking about MedPod for several years. So
right.
He's an early adopter.
And as I said before, he mentioned it to me a number of times, but it was really the interview that we had on Soul City that I said, wait a minute, this is something that I better understand. And now, here I am, a spokesman for, MedPod Technology and a friend of Jack. So thanks again, Jack, for your time. Between you and Ed, I'm out of retirement in a sense because Ed is a country boy. He calls me at 8:30 in the morning, and I said, Ed, I don't know how they do it in the South. You're not going to get a lot of rhythm.
You can't retire. I told you that story at one point that I had a long-term advisor. His name was Nelson Brahms. Passed away this past year at 104. But at 86, he came back to me and said, "How could I help you?"
Well, the best for me anyway. I don't know about others, but for me, the best business or the best way to develop an income is how you can help yourself by helping others. That's very fulfilling, and I think you have mentioned it yourself. I mean, we can do things that can help a few and help yourself, but if you can find a way that you can help a large number of people, and also find a way that can, provide you with the ability to eat, it's it's a win-win situation, and I always like those types of things. So I'm glad to be part of that uh, type of concept with you, Jack. Again, the soft opening, 140 between 144th, 145th, closer to 144th Street and Malcolm X Boulevard, December 18th and 19th. You can Harlem Community News. Most of the we did a pretty good job in getting the word out. But again, you can always contact Soul City, or you can reach me, uh, whether it's the Greater Harlem Chamber of Commerce or the Harlem Tourism Board. All of those entities are part of bringing this to life in Harlem. And Jack, uh, keep on doing what you're doing.
You too.
Matter of fact, we have a brief presentation at Silcom Harlem tomorrow. So
See you there.
we've been pretty busy, but it's a good thing. It's, as you say, it's good busy, right? It's like good trouble. Take care, man. I'll talk to you. Talk to you tomorrow, if not tonight.
Sounds
See
good.
you soon. Appreciate your time.
You too. Bye bye.
So again, one of the beautiful things about the soul cities of the world is that it provides a platform for this type of information. I hope that you take advantage of it. If you are able to view this, our soft opening at the MediLink is the clinic. It's the MediLink / MedPod, powered by MedPod Wellness Clinic. That will open up for information, a soft opening on December the 18th and December the 19th. The grand opening will be February the 6th. And there's a lot of opportunity, a lot of investment opportunities, a lot of career development opportunities, because this type of technology is new, but it's not only going to be national, as you could see with the video, it'll be international. So again, keep us focused. You'll hear more about this on WHCR. You hear more about this with all of the different news outlets in my network, but you'll be hearing a lot. But for many of you, you heard it first on the Urbanology show at soulcity.com. So this is Tony Rogers signing off to next week. Have a good weekend and take care. Bye.
This is Kia Rogers, and you're listening to Urbanology with my dad, Tony Rogers, on WHCR 90.3 FM New York.
Urbanology.